Hey everyone. Thank you everyone for taking the time to join, and I hope we continue to have more participants as we go along. This is the May 5th Africa Echo session, and today we will be covering the subject around securing financial, human, and technical resources for program implementation. We are fortunate to have two fantastic speakers, but before I introduce them, I just wanted to, again, remind us of the format. We will have two presentations from our great presenters who have graciously agreed to cover this topic. And I think it's bound to be a really interesting session. And then, as we go along, feel free to type questions into the chat, but then we will also have a discussion session at the end of the presentations. Also, as a matter of housekeeping, if you're not speaking, please mute. And if you have the bandwidth, please turn on your video so that we can see who we're talking to and who's in the attending today's session, and we'll go from there. So today we will be aimed to just really talk about address two objectives, to really discuss, ways to think outside of the box. So we're very aware that especially in the NCD space, and especially in the cancer space, there's limited funding for, implementing our different interventions around improving access to care or raising awareness or, advocacy. And so in that case, we really need to think outside of the box to stretch the dollar to achieve what we set out to do, which is ultimately to support our patients and to save lives. And the other objective will be to explore the importance of aligning our different initiatives with our individual national cancer control strategies. Hopefully your country has a plan. If not, there's certainly priorities that are guiding how we do our work in our different countries. And so just ensuring that what we're doing is in alignment. And so today we will start off first with our didactic speaker and then our case presentation. Each presenter will have about 10 minutes to present. And for our first speaker, I'm happy to actually present both speakers. Our first speaker will be Emily Kobayashi, who is the Senior Director for Non-Communicable Disease at the Clinton Health Access Initiative. So she's actually, a colleague and just a great person to work with in the cancer space. Her portfolio includes cardiovascular disease and the Cancer Access Partnership, which is, basically a partnership with the American Cancer Society and CHAI and several high-quality manufacturers, which is part of the Allied Against Cancer. She's a public health professional with extensive in-country experience in sub-Saharan Africa and globally across several health areas. In a variety of roles, she has worked to attract resources for community-based organizations, for NGOs and government partners to implement high-impact public health programs and strategies. CHAI is a global health organization committed to saving lives and just reducing the burden of disease in low and middle income countries. CHAI works with governments, private sector, and partners to create and sustain high quality health systems. And our second speaker is Tata Maya Evelyn. She is the founder and CEO of Humanity at Heart Internationals, a registered cancer prevention and advocacy organization with focus on breast and cervical cancer in Cameroon. She is a certified health advocate from the Philanthropy University and Wellness, and she's a wellness counselor. She also has a higher national diploma in office administration from IPIGD Douala and biochemistry from the University of Douala. She was one of the 2019 UICC Technical Fellowship awardee and shared learning with Women for Cancer Nairobi in Kenya. on cancer prevention and advocacy. We welcome our two presenters, and I'm gonna hand it over to Emily to start her presentation, after which Evelyn will give hers, and then we can have a conversation based on their presentation. Over to you, Emily. Thank you.
Great. Thank you very much for that introduction, Paulette. And it's an honor to be here today. I've learned so much from the Africa Echo sessions, and I have to confess, I usually listen to the recordings. But I just really want to just acknowledge this incredible group and all the people here today. And I see my presentation not as a didactic presentation of what you should do, and not one where we're going to solve the issue of resource mobilization for cancer control in the next 10 minutes, but rather to just plant some seeds for food for thought, and looking forward to the discussion that comes later in today's session. As Paulette mentioned, Clinton Health Access Initiative, we are a global health NGO, and I think it's important to note that we are not a donor organization. And I'm not speaking from the perspective of a donor organization, but rather today, my hope is to share with you my experience, my personal experience with CHAI and with other organizations in terms of fundraising, and again, just plant a few seeds and generate some food for thought for the later conversation. So I don't think I need to tell this group, and I think all of us are very familiar with the fact that we have many gaps in the delivery of cancer care in Africa. And we could start everywhere from community education, prevention approaches, screening approaches, diagnosis, tools, quality, responsiveness. And then when we think about the three pillars of treatment, surgery, radiotherapy, and medication, challenges that are specific to each of those pillars as well, and on and on. And I'm sure many people could add to this list. And underlying those challenges at each step in the cancer care cascade are a number of cross-cutting gaps, but I also feel that financial constraints is one of the most important. And I think that's something that all of us as practitioners working in different parts of the cascade have experienced and lived. And so if we were kings of the world and queens of the world, we would probably think of some program investments that could be made along the cascade. Here were a few I thought of, and well, probably some others you could also add, and yeah, those two, you could add those in, a couple more, all the way, probably missing some still, but definitely places where all of us would support program investments and more beyond. And then underlying these program investments, again, the need for many different types of cross-cutting investments, research, financial protection, patient navigation, empowerment, support, data and registries, and policy. And I do want to acknowledge that when we look for high resource settings, the way that all of these different pieces get investment is through universal health coverage systems and having insurance systems and other financial systems that support financial protection for patients, but also enable investment along the patient care cascade. So we all need to continue to be advocating for those types of systems and incorporating cancer treatment into those patient protection and universal health coverage systems. But in the meantime, what can we do to mobilize resources to make the things that need to happen, that we all know need to happen? And in our environment, we don't have one or two major donors. We don't really have very many major donors at all. And in this environment with limited resource mobilization opportunities and limited resources, we need to take a multifaceted approach. So I think some of us might think about, ideal world resource mobilization. Maybe you'd have a donor that, a source of funding. You would come up with this really compelling pitch. You would make it maybe in dramatic TED Talk type fashion. They would agree to fund you, you would get the grant, and then you go out and do your work and you save your lives. But I think we all know and have experienced that that's not how this works. And it really takes a number of different strategies. And this is where my talk is going to focus to take on. So I'm going to go through each of these as part of the talk. But at the end of the day, what it is really all about is putting together a basket of resources that enable us to do the things that we're trained to do, that we're skilled in doing, and go about saving lives. So let me start with delivering on the work as a first step in resource mobilization. So I think a lot of times people think resource mobilization starts with the donor or starts with a proposal, but really it's about where it really starts is with actually delivering on the work that you have and generating experience in a defined area of excellence. As you're generating that experience, as you're showing results, generating evidence around those successes, documentation, and then communicating the results where it matters. Sometimes we can feel that publication is the key to communicating our results, and that can be really good for some resource mobilization approaches. But in other cases, we might have donors that would be reading our local newspaper or who would be attending conferences with us. So just thinking about where we can communicate about results of the program that enables you to build your reputation as the go-to in the area in which you have expertise. And as you're building that reputation, you get more opportunities to deliver on your area of expertise. So I think what we're trying to go for in our organizations and institutions is becoming that go-to, having that reputation, and then as opportunities come up, people will recommend you, people will think of you, and you'll get the opportunity to generate more resources and have more opportunities to do good work. And one of the things that I think often gets overlooked when we talk about resource mobilization is that the highest probability approach is to actually grow the resources that you're getting with organizations that already know you well. So for a donor that you already have that's maybe already made a grant to you or has provided some funding or support, I think it's important to really deliver in a way that they can see and appreciate as well. So one piece of that is make sure you're meeting the requirements and the expectations, both in terms of what they funded you for, but also in terms of your reporting back to that donor. Understanding that donor, maintaining communication with them, knowing their areas of interest, and having that ongoing discussion with them is a great way to identify ways in which they might be interested in growing their support to you. Finding ways to extend the duration of their support. So if they're happy with, say, the first 2 years of work with you, seeing if there could be a third year or a follow-on proposal for a longer period of time is another really good way to establish sort of a foundation of resources that you can build on. Identifying mutual areas of interest. And then also a donor can be a very good partner for introducing you to other potential donors and partners. So donors talk to each other. They participate in meetings with other donors. They might have ideas for other people that would be interested. And donors like to see you get more funding because they believe in your work. They want you to succeed. And so they are sort of use those donors as a network to access other institutions or people that might be interested in supporting. And then I also wanted to mention, because I know some people on the ECHO calls might be getting some funding from government funders through sort of standard budget processes or through grants. And I think that government funders can be another really good source and a potentially sustainable source of resources. So if you're hoping to grow with the government funders, just a few questions to think about. One is that most of our government donors, like at the Ministry of Health, they have targets that they're working towards. And hopefully your program is helping to achieve them because it's working in alignment with the National Cancer Control Plan. So if you know, for example, the government really wants to have a greater number of people treated, how does your program help them to achieve that target from the National Cancer Control Plan and making that case to the relevant agency? Thinking about who are the key decision makers in the agency that you're targeting, and what evidence or requests do they need in order to reallocate or increase the budget available for your program, and what budget cycle are they operating under? So just really understanding the inner mechanisms of those government agencies that have budget that you may be able to access, and what they need in terms of evidence, what format the request needs to be in, and what the timing is when they would actually be able to make those decisions. Another key approach is to just look at ways to build partnerships, not just with donor organizations, but also with peer organizations. And this opens a new pathway for resources. So I think peer organizations that are working in the same space, we can definitely see many examples of how building a network that way can be very helpful. And you can augment each other's reach and share information about things that are very relevant to you. The second set of partnerships would be with complementary organizations. So these would be organizations that work in areas that you do not work in. So for example, if you're an organization that focuses on screening, awareness, and advocacy, having a partnership with an organization that can improve access to treatment, support patients to treatment. But I also wanted to throw out a third category of organizations that you can build partnerships, and that could just be organizations that you admire, where there may not be an immediate or an obvious connection, but you feel that your values are aligned and your approaches are aligned. And organizations like that can introduce you to new opportunities, can help you develop innovative approaches. This could be working with academics when you're an implementing organization, or working with a hospital when you're a community-based group. I think that even if you don't have an immediate way that your partnership would make sense, developing things together could be another way to sort of open up new opportunities. And with these peers and partners, we can also work on that advocacy, agenda setting, and trying to mobilize more resources and more donor and funder interests. So this one, the next approach I wanted to talk about is sort of baiting different hooks for different fish. So we're going to go back to that sort of idea of having a defined area of excellence. But I think it's pretty apparent that if you're only in one area, that might limit what you can do. And you might want to try out new areas that are adjacent to the area that you're working in, because that would give you opportunities to reach different donors that might have different interests. But there's also a way, if you have an area of excellence, you could also think about what are different angles that you could use that would open up new funding streams for you. So for example, we've got our fishing boat here, and say you have a program that is focused on lab strengthening for cancer. So the number of donors that actually fund just lab strengthening for cancer is very small. But you might be able to access some donors that are very interested in technology, data, innovation. That might be a new hook. And they might not be cancer focused or labs focused, but if you had a component of your labs program that could fit with this, you could pull them in that way. You might also have donors that are really cancer specific. So they're probably going to be focused on diagnostics for breast cancer or cervical cancer. So bringing them in. Maybe there's an angle on access to innovative medicines. This seems to be an area that a lot of people are very keen on and interested in. So you could talk about how lab strengthening would help to lay the groundwork for innovative medicines. And just one other idea is maybe research. There are research grants that might be accessible that aren't accessible just for implementing organizations. So could you put together a partnership around lab system strengthening research? This is just a few ideas, but just to give you a sense of, you're still delivering on your defined area of excellence, your lab strengthening program, but there might be different universes of data or different types of donors that you could access as you put a different spin on your work or a different area of focus in your work. As you're looking at donors and bringing donors in, one of the key things is to really know them and understand them and what makes them tick and what types of approaches would potentially be most effective for them. So one thing that I can't overemphasize is just reading what donors put out, especially if there is sort of a formal proposal opportunity or something like that. Read everything that they put out. This is really important to understand the language that they use, the keywords they use to describe the types of things they support and what they're looking for. Understanding what and who they can and can't fund. I have to admit, I've spent time developing proposals in cases where our organization was actually not eligible to be funded by that donor. So understand that upfront, day one, and save yourself the time. And as much as you can, have an in-person relationship. So talking to a person at the donor is much more effective for you to understand what they're looking for and for them to understand what you're about. Fostering site visits where possible and helping them however you can to visualize and feel ownership of the work as you're working with that donor. And then the last thing was just to sort of say that in this resource constrained environments, we do need to try everything. There are lots of different potential resource streams, and I think Evelyn's presentation has some really great examples of how she's doing that with her organization, Humanity at Heart. Here were a few that I thought of, thinking about global health donors that are maybe not funding cancer now, but are in a related space. That's one option. Private sector, both globally and local private sector in the country where you're working, religious communities, embassies, entrepreneurship that aligns with the goals of your program, personal relationships and individuals that might have access to people with resources. Innovation funds are another kind of hot area in philanthropy right now. So finding ways to access those. With the one caveat, as you go after these, is always remember to stay true to your values as an organization, however you define them. And I just want to pass that on because it's something I've learned from a wise mentor of mine in terms of if you ever compromise your values, it's very hard to get back to where you were. And so depending on what you've set as your values for the organization, making sure that the funding that you receive doesn't compromise that. So this is just the beginning. These are just 6 that I wanted to throw out there. I think in our discussion, we can definitely come up with more. And with that, I will close. I am providing my contact information. I'd be happy to talk to anyone that would be interested in our cancer medicines access work. But also if you're interested in brainstorming about your specific situation, I'd be happy to do that as well. Thank you.
Thanks so much, Emily. Really appreciate that presentation. Over to you, Evelyn.
Thank you so much, Paulette, and thank you so much for the steering committee. You know, when I received this invitation to talk, I was like wondering what I was going to talk, since it's a very sensitive topic for all of us at the CSO levels. But it's good to share what we are doing here at the level of humanity at heart in Cameroon. Next slide, Charles. So before I could go into how we secure finances, let me just give a brief preview of who we are. Humanity at Heart International is actually a registered cancer prevention and advocacy organization with focus on breast and cervical cancer. And our mission is to bring hope to the hopeless. And we do that by raising public awareness and improving community health literacy on breast and cervical cancer prevention, early detection, and diagnosis. And when we do this, when we create awareness, we help facilitate access to treatment centers for those who are diagnosed positive. And by so doing, we know we are reducing our morbidity as we align with our National Cancer Control Plan. So for some of you that don't know more about Cameroon, let me just walk you through where our organization is located. So Cameroon is actually in the central part of Africa, with a population as estimated by UN data as of 15 April at over 27 million. And actually our population growth rate is at 2.6. And this population is actually so young, like below 45. We have a surface area of about 475,000 square kilometers, and our health system actually involves 3 subsectors. We have the public, we have the private, and we have the confessional. When I mean confessional, we have the faith-based organizations, we have the traditional medicine as well. So our work at Humanity at Heart actually aligns with the National Cancer Control Plan, and some key facts from our NCC, I just highlighted a few. We have priority strategies and action plan, which is for over 5 years, which started already in 2020, and obviously will be ending in 2024. And these actions are grouped into 3 strategic components. We have the primary, the secondary, and the tertiary prevention. The objective of the strategic plan actually is to reduce morbidity and mortality due to cancer by at least 10% by 2024. And the vision of this is to establish a holistic management of cancer control available in Cameroon by 2035. So the implementation of this plan is coordinated by the National Cancer Control Committee, which is headed by an executive secretary with over 15 staff. The National Cancer Control Committee actually is the cancer arm of the Ministry of Health. And all the CSOs, the private and confessional sectors report to the National Cancer Control Committee, which eventually reports its work on cancer to the Ministry of Health. So the Humanity at Heart works in full alignment with the National Cancer Control priorities, contributing to their implementation. So what we do is we educate our team on relevant information or priorities from the National Cancer Control Committee in 3-step process as we go through the year. So step 1, what we do, we actually scope out specific activities, what we are going to do throughout the year, the approaches we are going to take. And then we agree on who is responsible for each task. And then we set timelines and objectives on how to achieve these tasks from different groups that are responsible for each task. And the second step, in order to implement this, we identify the resources that we need and the necessary partners, which is also very challenging though, and the funds to successfully implement this priority. As we have been lobbying, like it's for a while, we lobby for the Ministry of Health on the need to establish a dedicated budget for all the works of CSOs that are fighting in the cancer space in Cameroon. We are still on the process. So we are hoping that the Ministry of Health will actually dedicate a budget for most of our cancer activities. And the third step that we do, we actually track progress on the implementation nationally and also review fundraising, feedbacks, and impact of our activities. So some steps that we have been doing to mobilize resources. What we actually do, after having scoped out the activities that we want to run throughout the year, we now plan on what we need, what do we really need to do, and then we look at the types of skills or capabilities that we will be requiring. That is a planning phase on how to mobilize resources. We sit, we plan on what to do, which skills we will be needing, and the capabilities that we will require. And then we do an estimate. We estimate how much of each type of capability is required and how we can rationalize the skilled defined roles. And then we actually now move into the resource proper, and then we try to seek who should we contact for what, which people might we obtain to meet those needs, how do we assign actual resources to fill those roles in which we have put down, and what impact has the actual allocation had on the plan and the estimate. So from the planning stage, I just cited an example of what we have been doing recently. Like we had the project of projecting the Conquering Cancer documentary on the university campuses. We had to plan who should we meet, how should we raise funds, what skills do we require, and then we equally go and look forward whether we have community health workers, peer educators, specialists, or oncologists that can join us in projecting this cancer documentary. So those are the steps that we take. We plan, we estimate, then we now do the resource mobilization proper. Next slide, please. So when it comes to financial resources, the first thing we've been doing all these years, we write and submit proposals. You all will agree with me that this can take a while. Like Emily had said before, you need to really identify the perfect partner, the perfect donor, how you have to pitch your proposal, what is needed. So we have been doing that, even though it's been challenging. Any proposal that we write that is not being funded, what we do, we receive feedbacks from the donor agencies and improve on better ways to write and better ways to properly pitch our proposal. I think what Emily said has helped a lot. That is going to equally help us in pitching more proposals. And then aside from writing and submitting proposals, what we do, we also organize fundraising events and invite guests to donate for a cause. We can decide, okay, like we are creating awareness in communities. We like 2 years ago, we had a project on Operation 1000 Women, where we want to screen up to 1000 women annually. That is a cause we have put. So we organize a fundraiser for that, and then we try to implement. And then what has also helped us through the years is the annual contributions from the Humanity at Heart International team. We have a yearly contribution, which at the end, annually it can amount up to $1,600. I think little is just enough to do greater work here. And then we also have a running business at the Humanity I had, like Paulette had introduced. I'm a wellness counselor as well. And what we do, we have some of the organic products for some people that can take, and we do that, we sell that, and the proceeds from this also help in carrying out some of our activities. And this business is the mainstream of income as well that has been helping us to run most of our programs when we do not have funds from funding agencies, or maybe the fund from events that we have been raising is not enough. This stream of income have been there to help us to run some of our programs. And then what we are anticipating to do is we want to put a donation box at the level of the center, where we request for small amounts from the public, maybe those who are coming to the center. We explain our cause, we explain our mission, and if they are up enough to donate, they can just drop their donations in the donation box, and we can see how to help our cancer patients. And we have also had like in-kind donations, like when we are carrying out projects in the community, some people can just decide to offer food, maybe for the participants. Some people can decide to offer accommodation for the staff if we are out of station. And some people choose to support our cancer patients that we navigate from sites. So for human resource, I think the staff and the volunteers of Humanity at Heart have been so supportive. Like the volunteers periodically, when we have events, and then leave. And then the next event, we can still contact them to come and help us do community service. So they dedicate their time and the energy to help us at Humanity at Heart. We have 6 permanent staff at the organization that will run the activities. And for technical support, we actually do most of our work in collaboration with the National Cancer Control Committee and other health facilities for technical support. Like when we go out and create awareness, we do not have the necessary tools at the organization, maybe to screen. What we do, we talk with other partner clinics that have the necessary tools. We go on with vaccinations, we screen, and then treat precancerous lesions, and then refer those with invasive cancers to other partner clinics for proper management. Some of the challenges actually that we have faced, like all of us, we resonate with this. We have limited financial and technical resources. The little that we have is what we have been trying to cope with, and wishing for better funds to properly implement some of the programs from the National Cancer Control Program. We also have language and cultural divide. Sometimes we go to places that you are unable to speak the language of the people. You will need people to interpret, and maybe in the course of interpretation, they might not send out the right information. And you are making sure that what they are trying to interpret is what actually is being said. And recently in Cameroon, we have had social crisis. We have the English-speaking crisis from the north and southwest, and then we have refugees in the east region, and then the Boko Haram in the north. So these have really hampered most of our programs because movement sometimes is actually restricted. And fear of gunshots, you need to just wait until it's calm before you go out there. And then all of us know that COVID has been a major impact on most of our programs as we implement in the cancer control. And then sometimes the community shows no interest. They don't want to get involved. They have their way of thinking. They stigmatize that this can never happen in our community, and so they will not get involved in it. So those are some of the challenges that we face out there. In spite of all these challenges, I know we won't stop because cancer doesn't really stop. And I believe that with the few resources that we have, we will actually conquer cancer. As you can see from the pictures, we just came from the Northwest in spite of the crisis, and the turnout was great. And all this group of girls and women have opted for vaccination and screening. So to me, with or without these challenges, the little that we have, we just need to forge ahead, because cancer is something that we need to unite and eliminate. So we win because we play together as a team. And I want to thank the team. I want to thank all of you for giving this opportunity to share our experiences. Thank you.
Thank you so much. That was really humbling. Evelyn, you're doing a lot of work with very limited resources, and I was just really humbled at the amount of work that you've done, and that you're getting women to agree to vaccination and screening in sub-Saharan Africa with all misconceptions around vaccination and screening. That's really amazing. Thank you so much. It was really difficult to try to stop you, although we had really gone over time of presentation, but hopefully all that you shared and also what Emily shared will just allow for conversation in the few minutes that we have. So this is now the discussion session. Emily, if you can, and you want to show that last slide, I think it's a good conversation starter, where we can all just look at that and say, okay, so we deliver on the work as Evelyn is rightfully doing. We grow with and work with existing supporters, we build partnerships. I mean, we're also saying, if anyone in the room has recommendations on what else we can be doing, what else Evelyn can be doing, what else everyone on this call who's doing the work can be doing to basically mobilize resources, that'd be great. Evelyn and Emily will answer your questions if you have any, but we also welcome contribution from participants. So the discussion session is open. Please feel free. And if you don't want to unmute and speak, you can also just type in the chat box and I'll read it out. Go ahead, Benda.
Good morning, good afternoon, good evening, everyone. This is Benda Kitaka. So my question, it's actually a comment first to Evelyn. Delighted to listen to you. Quite inspirational, and congratulations on the Conquering Cancer movie screening. Very well done. And for all the work that you're doing under very difficult circumstances. My question goes to our first presenter, and recognizing that from the opening, you did mention that Chai is not an funder. And yet, watching the work that we do, even in Kenya, Chai has been quite instrumental in supporting some of the work that the government does, and also by extension, then advancing the discussions around the work that we are doing in the cervical cancer space, as well as other areas like vaccines delivery and all. So my question would be, Emily, recognizing that, yes, you're not a funder in the traditional sense, but as an organization, you have budgets that would support other smaller organizations, maybe in capacity building or in building capacities for them to be able to engage with government more effectively. How would you advise organizations that want to partner with Chai? What would be the approach that you would mention then that organizations can follow on through? Thank you. And that goes for engaging other civil society organizations or other NGOs that are international in the local scenario. So it's not just about Chai, it's also engaging other partners that could be in the same space that we can work with collaboratively. Thank you so much.
Paulette, you'd like me to go ahead?
Yes, please, go ahead.
Great. Well, it's an excellent question, and really thank you for that insight and perspective. So, when I say we're not a donor, so we are an NGO. We also do fundraising. Most of our funding comes from grants from institutions. And so when we're writing a grant, we are setting out specific deliverables, specific areas of work that we're going to take on with that donor's resources. And for the most part, we do. We don't usually subgrant, but we will subgrant when there's a capability that a CSO or another NGO has that we don't have. So often that's done actually at the proposal writing stage, where we put together our partnership and go to the donor together to say, maybe, one NGO is very specialized in evidence generation, and CHAI is going to be more specialized in implementation. But together we think we have a really compelling program. I think with CSOs, a large organization like CHAI, we would say, we're going to work at the level of the Ministry of Health Planning and Training, but CSOs are going to be key partners for us in mobilizing patients or screening participants, or people for screening, community mobilization. So I think that the best strategy would be to have the conversation with CHAI as one of those complementary partners, to start to understand how do we complement each other, and what kind of resources could we raise together where we would showcase that complementary partnership. That's going to be more likely something that we could do, rather than we already have a grant that we're implementing. It's very hard for us to add sub-partners later. I hope that's a helpful start.
Great, thank you, Emily. Brenda, did that help?
Yes, it did. Can I add a follow-on question? And this is me asking, I know in your didactic session, one of the things you mentioned is to know the funding cycles and also the budget cycles that we're working with. So if we were to take on that conversation and then say, yes, CHAI is one of the complementary partners that we're looking at, and we are keen to partner in terms of grant writing or resource mobilization together, are there opportunities that exist? For example, if, say, I work with Kilele, and if Kilele was to find grants that we think are a good fit for CHAI, but because CHAI is bigger, multi-country, is able to deliver on that front, but Kilele can be one of the implementing partners in country, and maybe Evelyn's organization, Humanity at Heart, can be an implementer in Cameroon. Could we then look at that, knowing what cycles you work with, so that we're able to start these conversations early? Thank you.
Great. Yeah. So I think for CHAI, we don't have a set cycle like that. We do an internal budget every year on the January to December cycle that starts. So we'll be doing that like starting in September. But in terms of like specific projects, in terms of putting together a budget or a proposal, that's entirely set by our donors. So we have all different kinds of cycles that we're working under, as I'm sure you do as well, where, this is a donor that funds Jan to December versus one that starts in June. So I think any time is the right time to start talking about the partnership, and then you're ready when the opportunities come up. Thank you.
Great, thank you, Emily and Brenda, for the follow-up question. So we unfortunately have only another 5 minutes. I'm gonna let Anna share her comment or question, and then Mishka, and unfortunately we will not be able to take more, but again, there's still base camp for more conversation. Go ahead, Anna, please.
Yeah, thank you. I cannot thank you enough for this presentation, the two of you, because this is the limiting factor of all of us doing more work everywhere. So thank you for that. I have two comments. One is to Evelyn. I'm really impressed with the planning that she does in the organization. And I think for fundraising, this is key to know, to really understand how much do you need, what are you going to do, be able to communicate that to funders and all that. One suggestion, she mentioned that there are a lot of volunteers supporting the organization, and that she'd probably like to grow the support in that community. And one good way to do that, instead of trying to get new volunteers, is to use the current volunteers or the people that are already giving to you to really help you reach out to the contacts that these people that you have, that they're already, convinced that you're doing a good job. These people can be really your best advocates in your community. And then, and this is something that also Emily mentioned in her talk. You have a funder, just work on that funder, really use that funder to get more money and to get you connections to additional funders. And finally, just that sometimes the collaboration between research and implementer or community-based organization, it's been underestimated and underused. And I think that it would be good if more connections or more collaborations were established between, academia and NGO, because it really, the work complements, not at all levels, but really researchers that are doing implementation kind of things, and implementers they really need the data and the evidence from research. So I think it's a really good space for people to explore. It's not going to work and it's not going to get you millions, tomorrow, but I think that it's a really good place to start exploring maybe new collaborations. That's all. Thank you.
Thank you so much. Over to you, Mishka.
Thank you. And thank you both for these great talks today. I had a question following up, I guess, to both of you really is, you've mentioned, talking with stakeholders, talking with funders, and I'm curious how much of your planning work goes into mapping stakeholders that you work with, or understanding who you're not tapping that you could, or not tapping, I shouldn't say that, but like engaging with. So I'm curious how that factors in, or if you have any guidance based on your experience, how others might be able to go through that type of a process.
Maybe from the global level, and I actually think it would be interesting to hear from Evelyn too, but from the global level, I actually find this is kind of where conferences, meetings, webinars are helpful to understanding the landscape, and just sort of having other organization partners pop up, getting ideas and things like that. So especially in COVID times, I feel like I'm on a webinar every day, but I do see value in that over time in terms of surfacing new stakeholders that we might not have been aware of, but would love to hear from a country perspective.
Just to chime in with what Emily said, at the level of Humanity at Heart, what we do, we actually, the first one too is from most of the webinars, the meetings that we have had. But what we have done here sometimes is to go out to these organizations and propose if they can work with us. For example, like the CBCHS, we actually went to them since they have the tools we do not have, and we propose collaboration. So it's over maybe 4 or 5 years we have been working in collaboration with the CBCHS. We actually go towards these other complementing stakeholders that we think that can complement our work, or we can work in collaboration with them, and then we propose to them. Not everybody agrees though. We work with the ones that actually are interested and see reasons with us to work with us.
Great, thank you. Those are really fantastic responses to the question. I just wanted to also add that sometimes even the non-traditional ones, right, they might not necessarily be doing complementary work. They very well could be a private sector bank that has extra money for CSR and looking for what to do with it. And you can just present that really valuable work that you're doing and show them how they can showcase how their work is, how their money is going towards that, and they'll jump in on it. So thank you. I just wanted to throw that out there, but thank you everyone. Really fantastic session. Evelyn and Emily, appreciate it. I will hand over to Charles now. But again, if there are other, I really hope that these conversations continue on Basecamp, because we can't exhaust the conversation, as Emily said, in 1 hour or in the 20 minutes or more of presentation, right? It has to be an ongoing conversation, and maybe again, taking her offer to brainstorm would be another way to do this. So thanks, everyone. Over to you, Charles.
So thank you very much, Paulette, for the good work this evening. I also want to thank our speakers for today, Emily and Evelyn. Thank you for the good talk. So we are going to share the recording on Basecamp, and also going to share the slides for reference. And like Paulette is saying, we can continue with the conversation there. So if you have relevant resources on the topic, you can share there as well, so that the community is also able to get that information. So our next session will be held on 19th May, that is 2 weeks from now, same time. And we are going to be focusing on the impact of COVID-19 on cancer control. So look out for the agenda on Basecamp sometimes next week, and please plan to join us then as we continue learning here in the Africa Eco community. So I don't know whether my colleagues, Mishka, and I don't know whether Amaka is there, whether they have anything to add.
Nothing from me, just to say thank you. Amaka, over to you. I think her network might be a little bit challenging today. Back to you, Paulette, and thank you very much for your leadership at today's session.
Sure. No, thank you, everyone. Again, I highly recommend brainstorming sessions, more conversation on Basecamp, and let's just. I think to Mishka's point, stakeholder mapping and just identifying even non-complementary donors, people who typically would not give towards cancer control work, and just showing them the relevance of it could go a long way. So thank you, everyone. Perhaps we can give folks back their 2 minutes, and have a good rest of the day. Thank you, everyone. Bye-bye.
Thank you, Paulette.
Thank you. Bye.